Hi everyone, welcome to my YouTube channel, My Health and Me by Fun. Please like, subscribe and share. Medical tests are crucial in diagnosing and treating health conditions. These tests give doctors the information they need to understand a patient's health status. Medical tests come in many forms, like blood tests, urine tests, imaging such as CT scans, ultrasound, MRIs, and X-rays. Each test provides a detailed look inside the body, revealing issues that may not be visible otherwise. Regular medical tests can also help in the early detection of diseases, leading to more effective treatment. Blood tests are common medical tests. They involve taking a small blood sample for lab analysis. Blood tests reveal health information like infections and organ function. The process is simple and quick, with minimal discomfort. A complete blood count, CBC, helps diagnose conditions like anemia. Blood sugar tests diagnose diabetes. Cholesterol tests assess heart disease risk. Blood tests are essential for diagnosing many conditions. MRI stands for magnetic resonance imaging. It uses magnets and radio waves to create detailed images of the inside of the body without using radiation. MRIs are particularly useful for examining soft tissues such as the brain, muscles, and joints. The MRI procedure is straightforward but can be lengthy, requiring patients to remain still during the scan. The machine makes loud noises, so patients are often given earplugs. MRIs are used to diagnose a variety of conditions, including brain tumors, spinal cord injuries, and joint abnormalities. They are also useful in assessing the extent of damage after a stroke. Because of their detailed images, MRIs are a vital tool in modern diagnostics. They help diagnose many conditions without using radiation, making them a safer choice for detailed internal views. X-rays are another common medical test. They use a form of radiation to create images of the inside of the body, particularly good at showing bones and detecting fractures. X-rays can also reveal issues like lung infections or intestinal blockages. The process of getting an X-ray is quick and painless, usually taking just a few minutes. There are different types of X-rays for various purposes, such as chest X-rays for lung conditions and dental X-rays for teeth and jaw bones. Safety is a key concern with X-rays, but modern equipment uses minimal radiation and protective measures are always taken. With proper safety measures, they are an invaluable part of medical diagnostics. An ultrasound is a non-invasive imaging technique that uses high-frequency sound waves to produce images of the inside of the body. It is widely used in medical diagnostics to examine various organs and tissues, including the heart, liver, kidneys, and blood vessels, as well as for monitoring pregnancy. The ultrasound machine emits sound waves that bounce off internal structures and tissues. A handheld device called a transducer is placed on the skin, which sends sound waves into the body and receives the echoes that bounce back. The echoes are converted into real-time images displayed on a monitor, allowing doctors to visualize the area being examined. No incisions or injections are needed. Unlike X-rays or CT scans, ultrasound does not use ionizing radiation, making it safer for pregnant women and frequent use. Provides immediate visual feedback for dynamic processes like blood flow or fetal movement. The quality of the image depends on the skill and experience of the technician performing the scan. A urine test, urinalysis, is a diagnostic tool used to examine the content, concentration, and appearance of urine to detect signs of various medical conditions. It is commonly used to assess kidney function, detect infections, and diagnose metabolic disorders. Types of urine tests. Routine. Urinalysis examines the color and clarity of the urine. Chemical analysis tests for substances like glucose, proteins, ketones, and pH levels. Microscopic examination identifies elements like red blood cells, white blood cells, bacteria, and crystals. Urine culture detects bacterial infections in the urinary tract, UTI, by growing bacteria from the urine sample in a lab. 24-hour urine test collects all urine produced in 24 hours to measure substances like creatinine, protein, or calcium to assess kidney function. You may be asked to collect a midstream urine sample, clean catch sample, to avoid contamination from the skin or genital area. Urine MCS stands for urine microscopy, culture, and sensitivity. It is a specialized urine test used to diagnose urinary tract infections, UTIs, and determine the appropriate antibiotic treatment. This test examines urine for the presence of bacteria and white blood cells, identifies the specific type of bacteria causing the infection, and assesses which antibiotics are most effective against the bacteria. For microscopy, a microscope is used to examine urine for the presence of white blood cells, red blood cells, bacteria, and other elements, e.g., crystals, casts. This detects signs of infection, inflammation, or other conditions affecting the urinary tract. For culture, the urine sample is placed in a culture medium to allow any bacteria or fungi present to grow. It identifies the specific microorganism causing the infection, e.g., E. coli, Klebsiella, etc. For sensitivity, once the bacteria are identified, they are tested against different antibiotics to determine which ones are effective. This helps healthcare providers choose the most effective antibiotic to treat the infection, preventing antibiotic resistance. A clean catch midstream urine sample is usually required to avoid contamination from external bacteria. A CT scan, computed tomography scan, is an advanced imaging technique that uses X-rays and computer technology to create detailed cross-sectional images of the body. It provides more information than regular X-rays by producing three-dimensional 3D images of bones, blood vessels, and soft tissues. CT scans are commonly used to diagnose various conditions and monitor treatment progress. The machine rotates around the body, emitting X-rays from different angles. A detector collects the X-ray signals that pass through the body. The data is processed by a computer to produce detailed layered images, slices, of the body part being examined. These slices can be stacked together to create a 3D image, allowing doctors to view the area from different perspectives. In some cases, you may be given contrast dye, either orally or through an IV, to enhance the visibility of certain tissues or blood vessels. If contrast is used, you may be asked to avoid food or drink for a few hours before the scan. Jewelry, glasses, or metal objects should be removed before the scan as they can interfere with the images. During the scan, you will lie on a table that slides into the CT scanner. The scan is quick and painless, usually lasting between 10 to 30 minutes. You may need to hold your breath briefly while the machine takes images. If contrast dye is used, you may feel a warm sensation or have a metallic taste in your mouth. CT scan produces highly detailed images of bones, organs, and tissues. Blood tests, MRIs, and X-rays are essential tools in modern medicine. Blood tests provide quick and vital information about a patient's health. Consult healthcare providers for detailed information. Thank you for watching. For more health tips and information, please like, share, and subscribe.